You know, family trauma is a really difficult thing to deal with. It's really hard to try to, help your heart and your mind conceptualize the trauma that can sometimes be at the very foundation of your situation. I've had a lot of clients over the past 14 years of my career say to me, how come this trauma has happened to me from the way that my family members have treated me? Why can't we seem to bond and do well together and love each other and just be support for each other? Why do they treat me this way? Why do they look at me this way? And I never have a well-rounded answer for that, because it's really not that easy to come up with a sensible explanation as to why. We've been born into this world with the idea that family is everything. We've also been born into this world relying on those who love us and care about us and are supposed to protect us. So when they do something to us and we feel traumatized and we feel overwhelmed by the things that they've done, it's really hard to conceptualize it. And for some of you, you may be experiencing post-traumatic stress disorder or some kind of acute stress reaction because of the things that your family has done. So in today's video, I'm going to cover what family trauma looks like, what it does to you, and then I'm going to also highlight some PTSD symptoms you may recognize. But before we get started, let me briefly introduce myself in case you are new. My name is Tamara, and I'm an internationally and board certified trauma therapist. I'm also licensed in mental health, and I specialize in treating children, teens, and families, as well as adults who are dealing with trauma. Let's jump in. My. So I'm going to start this off just a little bit differently. If you were with me earlier, or yesterday, I should say, I tried to do a live video on this particular topic, and it wasn't YouTube that hacked me. It was my camera system. And so it's like, it's one thing to the next. It's awful. But I appreciate you guys for being so kind and so sweet. Let's just go ahead and jump in, okay? I talked a little bit at the very beginning about, the difficulty in trying to manage family trauma. It's not an easy thing. And when you've been traumatized by your family, it's just hard to wrap your mind around. So in today's video, I'm going to talk about family trauma and, what's happening to you every time, you face or you try to process what has happened to you. So the first thing that you are likely to see in your family if you have family trauma is chronicity of traumatic experiences. So basically what that means is that you have a chronic pattern within your family of traumatic experiences. Now, a lot of people regard this as family curses. Some people regard it as intergenerational trauma. However you want to title it, it's a chronic pattern of trauma throughout the lifespan. If you feel that your family has traumatized you in some way, it might be helpful for you to go back into your history and back into the history of your family, I should say, and really take a look at the dynamics between your family members. Is this something that has happened before? Do we have a history of narcissism? Do we have a history of sociopaths? What's going on here? Is this a pattern over the lifespan? Is this a pattern that has happened in my particular family? So you're going to see a chronicity of traumatic experiences or a chronic pattern of traumatic experiences within your family. The next thing is conflictual family interactions. It's going to be difficult for you to maintain a normal, healthy, and positive relationship pattern with your family members if all throughout your family history, there has always been a difficult pattern. Now, I will say I do have a client like that. It's more of like a person who's consulting with me. They need some information on how to manage their family. And one of the things that they asked me was, why is it that it's really hard for my family to communicate? It feels like this communication pattern has been something that has occurred for many, many years with my family, and I can't seem to get out of it no matter how much therapy I have, no matter how many communication styles I try to adopt, and he can't find a way to make it work. And one of the things I told him is that a family lineage or intergenerational trauma or a family curse, whatever patterns, at the core of that is a family member who passed on through generations a certain way to communicate. And if your family hasn't gotten help along the way to alter how they communicate, then it is likely that the poor communication has happened over the lifespan. It's a pattern that has continued. And the only way that you're going to be able to change that, and this is for you guys too, is to change you. I will share some self-disclosure here. I feel like there's been a family curse in my family for many years, and it wasn't until myself, my cousin, and my brother, and my brothers, I guess I should say, both of them really looked at what the trauma is in our family, and we shifted how we respond to things. We've shifted, the people that we have allowed in our life. We also shifted our mindset. We also kind of, we ran after what we knew we needed to, as opposed to what our heart wanted us to, if that makes sense. So instead of us falling prey to the same emotional and psychological traps that has been happening throughout our family history, it's our family trauma, we decided to go the way that makes the most sense. So we really used our brain, we used our mind in changing the core of things, and or changing the pattern, I could also say. So sometimes you have to make that, that honest, pure change that's going to alter things in your life and in your family. Conflictual family communication, if you can change that just starting with you, that's all you need. The next thing is dangerous and angry patterns of communication and ways of behaving. That's another thing that happens in families with family trauma. It's something that can traumatize you as well. Maybe you and your uncle don't get along very well. Maybe you and your mom clash all the time. Maybe you and your cousin don't get along well. Maybe you guys aren't really able to communicate, and so you're always mismanaging each other's feelings, and you're always, really having a hard time just meshing. I know you have family members like that. That is another pattern of family trauma. It's that inability to control emotions, that inability to have that open communication, and that inability, to really connect where you need to connect. Maybe you've come from a family where there's a lot of anger and you don't know how to change the pattern of that. That is family trauma. Not being able to control emotions, control what you're thinking, not being able to control that impulsivity, right? That leads to that anger, or that leads to that mismanagement of your emotions and somebody else's needs, right? And wants. I think another thing that can be family trauma is really intense competition. I was trying to find the right way to put that. Really intense competition and bullying and harassment. That is something that can really happen in a family for many, many years. I think there's been some competition at the core of my family history for sure. I stopped it, however, and I think my brothers stopped it as well. But, family competition, harassment, bullying, all of that can happen within a family, and it can definitely traumatize you. I'm sure if you just pause and reflect over your family history, you'll probably find someone back in your family history who is competitive, harassing, and bullying other family members. I have, dealt with people, coworkers, friends, in my life, and even people who consult with me who are dealing with family members who are really competitive. That competitive edge is just awful. If it's in a family, to the point of disrupting other people's lives and their needs and their wants and their sense of safety, So, if you have that competition in your family, that bullying and harassment, that is family trauma as well. Abuse and neglect and any kind of maltreatment, I could say, I think that's definitely family trauma. And if you haven't been able to heal, if you haven't been able to push forward, if you haven't been able to, go away from these family members who neglected and abused you, traumatized you, then it's just like a repeat. It's another pattern in your family. It's a loop, you want to get out of that the best you can. Personality disorders and unresolved substance abuse and mental health challenges. This is definite family trauma, because the reality is this, that, somebody who has unresolved mental health and substance abuse issues, they're going to be a problem in your family. They're going to take you through a bunch of loops and mazes and underground passages until you get tired enough to say, you know what, I can't do this anymore, right? And I'm speaking more so for people who abuse substances. Now, those who have mental health issues and they're not getting help, we could put them in that category as well, where you may have to put up the boundary and say, you know what, I can't do this anymore. But if you're dealing with someone who has a severe mental illness and they can't help it and they're sick all of the time, of course you want to show them some compassion. But if this person is just, you know, tearing you down and ruining every ounce of your life and just draining you and making you feel, you know, confused and battered, then you need to walk away. Personality disorders, sociopaths, narcissists, even those with avoidant personality disorder can really put a burden upon your life. So you want to be able to look at this and say, you know what, this is not healthy for me. I need to move away. I need to go away. I also want to mention too, let me just briefly say, jealousy, family jealousy. I talk a lot about that right up here in this video if you want to go check that out. And I will post in the description box below some other videos that I've done on family jealousy. That is not okay, right? Family jealousy is horrible, and so is parent-child jealousy, right? And I'm talking about the kind of jealousy that disrupts the functionality of your life. It is there to destroy you. It is there to derail you. You don't need that, okay? So how do you know if you have post-traumatic stress disorder? Well, there's a couple of criteria that you probably need to be looking at in terms of, you know, not self-diagnosing, but just understanding your symptoms. So I'm going to highlight what this looks like. So, you know, anytime I see someone for family trauma, emotional trauma, psychological trauma, I notice that there's a pattern. And this is really what the diagnosis is. And I'm going to mention it right now. The first is a traumatic event, right? Any kind of traumatic event that you have had absolutely no ability to cope with. You've had absolutely no way to manage it. And you feel taken off guard. You feel, what's the word I'm looking for? Vulnerable and weak because of the trauma that is just taking you off guard, right? You didn't have the coping skills. You didn't have the ability to deal with it. It's not just the situation where you're a little bit, you know, nervous and anxious and a little depressed and you can move on. It's stayed with you. Sexual assault, sexual abuse, and rape victims go through this all the time. And, you know, they may have an encounter where they were almost violated or they were violated. And when they move away from the situation and try to live everyday life, they can't, because all they see is the person's face when they close their eyes. All they feel is their heartbeat increase and, you know, beat really hard and go, you know, beat fast, I should say, you know, walking by somebody who looks like the perpetrator, right? I've had women come into my practice and over the years I've been in the field say things like, I keep showering, I keep washing my face, I keep washing my hands, and I can't scrub my hands enough to get this out of my mind. That is trauma, okay? Not being able to move on and function in a healthy way. The next thing is avoidance of the thing that has caused you the trauma. And it might be something that represents the trauma. It might be something that is really close to what has traumatized you, right? It could be a bus, you know, if you had a car crash, it could be a bus that set you off. It could be a movie of a car crash. It could be smells of the oil that you smelled when you were in the car crash, right? It could be airbags deploying in somebody else's car. Sometimes we're on the highway and we drive past people who have been in a traumatic car crash, and sometimes you will see the airbags deployed. Just that in and of itself can cause a flashback. It could cause you to feel anxious, nervous, depressed, okay? So you may avoid all of those things in order to cope. Now, intrusion is something like intrusive memories, flashbacks, right? They intrude into your everyday awareness. So if you're having those kind of things every day or every other day, sometimes 3 months after the trauma, then that is PTSD. Am I getting flashbacks? Am I getting mental reminders? Am I getting nightmares? Am I having night terrors? Am I experiencing sleep paralysis, right? All of those things can be intrusion symptoms, okay, is what we call them. Now, disturbance of mood and cognition. So you're depressed, you're feeling emotional, you're having negative thoughts. Maybe you're having nightmares that are leading to breakdowns, that's leading to crying spells, that's leading to panic attacks, right? So there has to be some alteration in mood and cognition, okay? Some people experience depression and have absolutely no cognitive issues. They remember things, you know, they're not having gaps in memory, they're not neglecting to do things every day because they forgot, right? Some people just have the mood part of this. I'm depressed, I'm down, I'm anxious, and I don't know what else to do. Okay, so there may be a sense of helplessness and hopelessness as well. Now, the next is symptoms may not develop right after the trauma. Sometimes it happens 3 days after the trauma, sometimes 5 days, and sometimes 3 months later, right? And so it's really hard to pinpoint PTSD sometimes, especially directly after the event. It's almost like the person has to settle and the mind has to process it, because you can be numb, as you know, to family trauma. If you've had it, to any kind of trauma, you could be numb. And so it takes a while for the brain and the body to say, oh, that was a trauma. I'm now afraid. I'm now depressed. I'm now anxious. I'm now scattered in my everyday life. I can't remember anything, right? So sometimes the brain, it takes it a while to really settle and process what has happened so that you can see whether or not you have PTSD. But I often screen for PTSD 3 days after the event if I can, 5 days if I can, and within that 3 months time span, I really do try to screen my clients to see if they really are dealing with PTSD. Now, I'm going to also mention something known as adjustment disorders, and you may have been diagnosed with this or maybe not, or maybe you may be experiencing this and not even know it. Adjustment disorder can happen if it's not necessarily PTSD, but you're having a hard time readjusting to your life because of the trauma. You're having a hard time readjusting your mind and your mood, right? So you may really have difficulty sleeping. You may have some depression associated with whatever happened to you, right? But outside of that, you're functioning. You may have what we call adjustment disorder, mixed depression and anxiety. So you have depression and anxiety symptoms together, but it's only around that specific event. It's not like you're a depressed person. It's not like you're an anxious person. So let's say, for example, your family member turned his back on you after you needed him the most after your divorce, or maybe you needed to stay with him because you had something going on that was really bothersome and you needed some support. Whatever the situation may be for you with family trauma, if you're dealing with anxiety and depression after the fact, you might want to ask yourself, is this happening just with this, when I think about it, when I'm reminded about it, when I'm trying to understand it, or is it with everything else in life, right? So if you're not depressed in your life, you're not a depressed person, you're not an anxious person, but rather you're dealing with anxiety and depression around this specific family issue, it could be adjustment disorder. Sometimes there's adjustment disorder just with anxiety, and that's a possibility as well. Kids who have come to see me for school shootings, for overhearing that a friend overdosed. When adult family members come to me and say, my family member has severe mental illness, I need help. There may be an adjustment disorder with just anxiety, right? Or adjustment disorder with just depression, or both. So adjustment disorder is pretty, what's the word I'm looking for? It is versatile in trying to articulate and explain what your issue is at the time, if that makes sense. Okay, so you may not meet the criteria for PTSD, but you might meet it for adjustment disorder. This is a complicated topic, guys, so I figured I would go ahead and just pull this apart a little bit for you. I'm going to come back with another video on this. I'm going to try another live. I'm going to really try my best not to get hacked this time, so stick around for that. Let me know in the comment section below if this video was helpful to you. Thank you so much for being with me in today's video. Go ahead and hit that subscribe button and like button so that you can stick around and get more videos like this. I'll see you in the next one. Bye-bye.